Hi, Gary from Allegiant Physical Therapy in Durham, New Hampshire. Thank you so much for tuning in today. I thought I would take some time to talk about upper back pain. This is something that we're seeing more and more so in the clinic. People complaining of upper back pain and neck pain, which is not really too surprising given the circumstances with the pandemic. People working from home more and more, doing even more computer work, possibly moving away from their workstation even less than they did before. Durham, New Hampshire is a college town, so I do work with a lot of University of New Hampshire professors and staff, administrators, and even the students, even the young people come in with these types of complaints, upper back pain and neck pain associated with doing computer work, reading, studying, and that sort of thing, and even attending lectures nowadays. So typically what the complaints will be about is pain located between the shoulder blades and even up toward the base of the neck. Many times people will complain about and feel pain and strain and stiffness through the upper trapezius muscles and sometimes even further up into the neck. Which brings up an important point, and that is that the upper back pain complaint is closely associated with neck pain. It's hard to differentiate between the two because they are closely linked. And interestingly, the same type of thing, this postural strain, is a key factor in basically dealing with this problem and getting rid of the pain. So your posturing and positioning is really key. This type of problem can get worse over time, so that it can get worse through the day as your computer work activity continues into the afternoon, for example, and even over time, week after week, the condition worsening because you have to continue to work, but you're not necessarily cued into what to do about the problem. So it just kind of builds, basically. So the goal of the exercises in dealing with this problem is to deal with it naturally. So avoid a situation where potentially you have to have medication for it or injection therapy, something more significant, but strategies to deal with it on your own naturally, using exercises and some behavior modification related to improving your positioning and your posturing as you work. So we're going to go over some exercises now that are really good for this type of problem, and I hope that they help you. And so in case I don't forget, feel free to leave some comments below about the exercises and whether they helped you. So let's go to that first exercise. Okay, in this video we have Casey sitting in a fairly typical office type chair. And the goal here, the key here, is to get him sitting and positioned so that his body is upright. And you can see that here he's fairly upright and the weight of his head is right over his shoulders and well supported by his shoulders. If you look at this chair, and you specifically look at the back of the chair, you can see that it's reclined backward a fair amount. And we had to correct that using a lumbar cushion positioned behind his lower back, which basically fixed the problem in the chair and put him in a nice upright position. Also notice that his backside is well back in the seat of the chair and his feet are flat on the floor. So really this is the key in terms of dealing with this kind of problem. Get yourself positioned properly by using a proper chair with proper support, using additional support if you need to do that, getting in a nice upright position where the head is supported, and you should be able to maintain this position without having to do any work at all. So everything keeps you in that position. You don't have to work to stay there. Now that we have positioning taken care of, we want to get into some exercises that fall into the category of postural strengthening. The idea here is to get your head and neck into a nice, tall, neutral position and then do some strengthening exercises through the upper body. This is going to reteach your muscles how to properly position your head and neck and reduce the strain on all the tissues in your muscles and your joints through the upper back and the neck. In this exercise, Casey is performing a rowing exercise using therapy band or exercise band, pulling back, and while pulling back into that position, he's holding his shoulder blades kind of pinched together. And these are postural muscles, so you want to use some hold time. In other words, hold the pull back for a 5-second count. In this second exercise, he's doing something similar, but this time with the arms straight, he's pulling the exercise band down to his hips. But the key here again is pinching those shoulder blades back and holding them back. We want to strengthen those muscles around the shoulder blades and the base of the neck and reteach them how to hold your head and neck better. With this next exercise, you can see he's doing something similar, but in this case, instead of pulling straight down to his hips, he's pulling the therapy band out to the side more on a diagonal type of motion. Again, similar to the other exercises, but subtly different for the muscles that you're training. Don't forget that 5-second hold. That's really important. With this third exercise, now he's brought the exercise band up even higher, essentially pulling it straight back so his hands are at the level of his shoulders or slightly below. Again, pulling back, squeezing those shoulder blades, and holding for a count of 5. With all of these exercises, a good target is to do 3 separate sets of 10 repetitions, holding each pull for a 5-second count and taking a 1-minute rest between each of those 3 sets. So I really hope that these exercises can help you. I really think that they can. But if you have any problems with them or if they hurt for some reason, by all means, don't do them. If this doesn't work for you and you're still having a problem with your pain, you can see your local physical therapist or visit your doctor for help. Thank you for tuning in. My name is Gary from Allegiant Physical Therapy in Durham, New Hampshire. If you appreciate this content, please like it and subscribe to our page. And please, again, let us know how it works out for you in the comments below. Thank you.